So we are back with the other 9. Pretty big obstruction right here.
It's like putting a Band-Aid over a bullet hole until the time comes.
Oh. She's like, oh, that feels good. Lay him out because I don't think he wouldn't tolerate a standing enucleation.
Pony Tales Refuge is a full circle of life shelter founded in 2014. As a full circle of life shelter, we take in any horse, mule, donkey, or pony, no matter their age, size, breed, or training. Regardless of their background, we have never turned an animal in need away. Even after 10 years and over 1,100 animals that have come through our gates, you just never know what's going to happen. These are the horse rescue tales from the Tundra.
So we are back with the other 9. We made a second trip back down there. We're gonna get them.
7 of them are facing this way.
Yeah. Gonna get them unloaded. Come on, kids. You're gonna have to back out. There you go. Good boy, I believe. Mare. Wait, I think. Come on, you got it. There you go. There you go, come on. Come on out. Good job. You're gonna get your land legs back underneath you. Oh, geldings, no. There you go. Careful. Come on. There you go. Oh, you're blind in one eye too, I think. Alright. This is the one that was all covered in blood. You see lots of marks on her, him. I guess I still don't know where it came from. Let everyone settle in for a few days. Go around. You'll figure it out. There you go. What do you think, kids? Yeah, that one isn't good. We are up here cutting our third crop, or third cutting, I should say, off this field. Probably our last off of this one, but maybe not. Never know. The first cutting off it was garbage. We ended up giving it to a farmer friend of ours, and his pigs wouldn't even eat it, so whatever. Anyway, Nate wanted me to come up here and record this because it's the 540 or 450 tractor pulling the baler, and he says that's cool. So here we are recording at 450. I see it on there now. Yeah. So here we go. Looks like really nice hay. To elaborate a bit, I guess, this tractor normally just maybe rakes a little bit, Nate says. I don't know. But today it's pulling the baler, so that's super cool, I'm told. Go 450. Boop boop. What are you doing?
We have to go start getting the trails ready for our annual trail ride. We have to take this pristine piece of equipment out and see if there's any trees, brush, other obstructions that we need to get out of the way. A lot of the trails don't, nobody uses them other than us once a year, so trees tip over, things like that happens. We gotta make sure it's clear so we can get through with the horses.
And you use the fanciest tractor you have, right?
It's, yes, by far the nicest tractor in the fleet.
Cooks Valley Farm Alley.
It's mint if you squint.
Pretty big obstruction right here.
Okay, so Kaya is in here trying on the boots that we got from High C.
I see, we have to say what they are.
So today I'm trying on the PVC rain boots from High C.
If they don't fit, just say so. I'll take them.
I'll take them. They actually kind of fit. They're a little big, but I'll make them work. Oh, pants just ripped.
Again.
Okay.
The jeans fit over them.
Yeah,
That's a plus.
No, that's important.
they're a little big. They look a little wonky.
How comfortable are they though?
These are actually so comfortable.
Are they nice?
They're like little mattresses. Way better than my boots. Okay, so me, Leah, and Brooke are going on a trail ride. I have a Lannis. Leah is riding bareback Wilson, and Wrangler's over there, but Brooke is unloading Dutch. Update on the boots. They don't collect mud as much as my cowgirl boots do. They definitely weigh down a little bit more because mud gets stuck on the side or up in them or in the holes I have in them. But these ones definitely don't collect mud. They just kind of, I don't know, reflect it. I've only been wearing them for like 45 minutes-ish, and I'd so far rate them a 7 out of 10 just because I haven't, you know, really rode a horse in them, haven't gone through a ton of mud or water. But so far they're holding up great, and I enjoy them, and they are very comfortable on my feet. Okay, so the boots do fit nicely in the stirrups. These, oh, that's a look. These stirrups are a little long for me. I adjusted them, but I didn't adjust them enough. And I'm already up on this big lad, and I don't want to get back down. But they do fit nicely in there, and they're not uncomfortable at all. They're very comfortable. Alright, it's a little bit windy. I'm not sure if you'll be able to hear me. But in the stirrups, there's like the foam, the padding at the bottom of the boot. Definitely like, it's almost like a cushion on your foot. And when it's in like the stirrups, since they're a little long right now, they like stretch my foot. But the padding is really nice on them, and it feels good. So that's a plus, because my feet really hurt sometimes. Okay, one thing about the back of the rain boots, when Alanis here doesn't want to move and I go to kick her, I definitely have to put more heel into it, just because like on my cowgirl boots there's like that little lip that like can, you know, touch them a little bit better, but there isn't really a lip on these boots, which it's still okay, it's just different. You're okay. You're okay. Come on. Yeah, look at the scary mud. Video. I just need to leave. We see some baby deers. Okay, you really can't see them, but they're staring back at us. And there's a baby. Update. Oops. Boots are still holding up. They are comfortable on my feet. My arch is a little sore right now, but like I said, there's like that padding there just because my stirrups are a little long. I definitely should have just gotten off and adjusted them, but when I got on the first time, my pants ripped a little bit, and I'm trying to avoid that so I don't have shorts by the end of the day. I like them chunky. The boots checked out for the trail ride. They fit in the stirrups nice. They're very comfortable. They support my feet because again I have feet problems and they're very sore all the time. Why are you waving? Weird.
So today we've got Polly here. We are gonna get some horses up in the barn trimmed up, and then we're gonna head down to quarantine and get shoes pulled because tomorrow Dr. Kristin's coming and we've got a busy day, but thankfully we do have quite a few helpers coming. So we're gonna get started.
Sloughing off, isn't it?
Yeah, it's working its way forward. The body's rejecting it.
We had thought it was doing that a while ago when Dave said it would.
Yep.
We put her on antibiotics and it helped it, but
And then there's one back here at some point.
what's going on there?
There was an abscess that blew out there at one point too. But yeah, that looks like the body is not that aggressively.
So the body's rejecting what?
The whole foot. It's sloughing the whole hoof. The whole capsule. Yeah. One day you'll come out and there'll be a shell of a hoof laying there and a coffin bone.
My understanding is all you can really do is wrap it.
Yeah. Yeah. It's like putting a band-aid over a bullet hole until the time comes. Even.
Yeah, when she moves.
Yeah.
So can she like feel it a lot? I've never seen this before.
What's that?
Depends on how much nerve damage there is.
Usually at this point,
That's like talking in the video.
like at this point, there's, like she said, there's so much nerve damage. I mean, what she does feel is less than your typical abscess because it's dead. Surprisingly, she looks decent body condition from what she should look like in theory for the stress. The main thing is to watch for infection.
That's why I put her on the
Yeah,
right away.
see what,
And it was like oozy and gross, and like by the next day it wasn't oozy and gross anymore. But now
This
the
doesn't
legs kinda started to-
Yeah, you can see here this part where it's all bulging out and flexing. Oh yeah. Oof. Oh God.
Mush.
That's. You got a glove?
A glove?
Yeah.
What are you gonna do?
Well, I just don't know what the hell that all is there. And I don't know if it's.
I think we just need it.
Yeah. Ooh, God damn, that's all dead. It's dead. Son of a bitch.
I didn't realize it was so small.
I won't touch it. I'm just gonna touch the.
Is there anything we can put on it besides fly spray?
We can grab it if you want to grab a couple diapers. And at least the way it is now, we might be able to get it around the toe of the hoof too.
We have diapers?
Oh shit.
Yeah.
Oh boy.
In the middle.
Oh honey. Oh goddamn. That is like right there.
It's about off.
Yeah. Yeah.
So now we are headed over to quarantine to get those shoes pulled, and then we'll see Dr. Kristin tomorrow. Okay, so this is Raisa, I think is how you say her name. I've got her x-rays over here.
That's the one she's really sore on, the right.
The coffin bone already wearing off.
That's what we think.
Mm-hmm. It's like it's. Okay.
Bit of sinking there too.
Yes.
That's the other one.
Ooh, that ain't much better.
And she's got
And then her knee aches already.
that one wasn't horrible, but
Okay.
So I personally don't have much hope. Obviously, we'll let Kristin look tomorrow, but
Yeah.
you probably wouldn't even want to.
There's not much
What
you
do
can
you
do when there's your foot and your coffin bone's already wearing through or ready to wear through.
Yeah, and it looks like right here that like it's already disintegrating.
Right.
she's decent for her feet.
Decent. Just for being in pain, she's decent enough. Right there.
The what? The
The bulge.
So you can mess with them.
It's right there.
She can go.
So that's why she's trying to walk on her heel as much as she can to get that pressure off.
He knows the cut off tail.
Yeah, so they knew she was gonna die.
They didn't care how we were going.
They just wanted her tail. I can tell you it wasn't an Amish that did her feet.
No?
No.
They look nice?
Well, they're factory borium shoes, not homemade ones.
Okay.
Is she cross? She's not pure standy, is she?
I'm thinking she's crossed.
She's,
She's not branded standees.
No. Mr. Michael Phelps.
well, it's really, that wasn't even bent, it was just it wasn't put on balance, and then over time it bends on its own. So yeah, it's like if you hold it Like that. You can see how that side's higher.
Yeah, I do see that.
Yeah. And both of them are flat to his heels.
This is Brody Malone.
Oh God, I hope you behave for your feet. It's not looking that way, is it?
Not really.
Come on. He was really overdue. Holy cats. I'm just gonna drop nails and pick him up with a magnet. I'm gonna try to be fast with him because he's got like holding a grenade back here. Shoes have been on so long they're wore all the way down past the nail head almost. Jesus. This one was an Amish shoe job. Oh my God. Jesus. Inbred cocksucking fucking. Oh, I fucking hate Amish.
Loose.
Look at the nail heads though. Sad part is he's so long when we trim him, you won't even see these big old chunks that he's gonna have missing. Good God. That's a rough
Alright, well that's everyone for now.
Okie dokie.
So I was coming up here to help them with hay, and it looks like someone has a flat tire, question mark? Oh, the hay wagon.
I heard a clunking noise and I knew to come back and see it. It wasn't good.
Yeah, this is not good.
It is not good.
Hey, you want us to start unloading the other one?
Well, we need to move the kickoff to the back of the barn. Do you know how to move it?
Oh, you just
We'll be done. We'll be done.
You just push it?
Oh, you're fine. I came driving by and I just saw one of our hay wagons sitting on the side of the road. I was like,
I know, I came down the road and I was
Didn't
like,
move it all.
oh, looks like someone's stuck on the road.
And of course, it's not
gotta be
But I was
us.
like,
elongated or you
well, it looks like there's a hay wagon in front of it, and I was like,
That's probably
oh boy, something's going on. And I found out we almost lost a tire.
Let me push it back or?
If you can,
tire wheel
there,
it
that's
does.
it.
Yeah.
Yeah, I drove by, I looked for a flat tire. The tires all look good, but the wheel not so much.
So Dr. Kristin is here today. We have a lot of helpers here. We're hoping that this goes really smoothly. We're starting over in the barn with a dental and then taking a peek at Bobby McGee again, and then we will head down to quarantine and get 18 of the 20 horses looked at. 2 of them are just not handleable enough, too nervous, too scared. We don't need horses getting worked up, going through fences, getting hurt, anything like that. So we'll go get them looked at, and yeah, hopefully it's a pretty smooth day.
It was kind of is this, that's it right there, it looks like. I think so. Okay. But this is when you guys started to do some obliques and things like that?
Yeah, after you told us to get some newer ones.
But this is the only leg that's puffy?
Correct.
Because I remember seeing this, and I thought that was unusual. Like, but that's not, I don't think, going to hurt anything at this point. Because that was the only one, so this was definitely his right hock, right? Because I thought that was awful suspicious looking, and trying to figure out where, because that looks light right there.
Right.
There's his left, so of course you don't see it there in comparison. Because I couldn't tell exactly which bone it was in. This is his left again, okay. This is the only right you retook, okay. But if I want, I can open them up down here.
Oh, look at that.
Okay.
Figuring it out. No worries.
Just a different x-ray system. This is his right. Yeah, I don't know why I can't. In the other views, all I see is that one light-colored spot. I mean, is it right here? But that seems smaller than this. Because we're taking 8-1 and 7:30. And it's still puffy. Well, let's take a look at him. That's on the outside. That's why I thought taking one in this angle, it would like silhouette it on the outside. That's his left, okay. And it could be that right there. Which looks like it would be in the talus, and so that would mean, this is his right, that could be like the front of this part.
Okay.
Or it could be in, yeah. All right, let's take a look at that little dude.
Tiny baby, what do you think? Look at your tiny fly mask. Hi. What do you think?
You have big legs. Oh, owie. Okay. But that came up really suddenly, right? Like you thought he got... She taking good care of him, being a good mama?
Just trying not to step on them.
What's still, buddy? Oh, this is getting too small for you.
Are you outgrowing it? You're outgrowing it already?
Just for a minute, then we'll take it off and get you a new one.
Yeah, what do you think, little man? So you guys have taken a look at it, and I know being a foal, he's going to be awesome about this, but oh my goodness. I'm doing it. It's me. This guy kind of like rubs on.
Walking on it better than he was.
Is he?
But like me and Ray yesterday both thought it looked tougher than carpet.
I think it looks bigger.
Mm-hmm.
Most certainly.
Oh, buddy, I'm going to take your temperature and stuff. Yeah, don't smush anybody.
I'm so sick of stuff getting shoved up my butt.
You've already been doing that?
Well, he had like 3 enemas. And
Oh. You're on my toe, but at least you're small. Yeah, 99.5. Yeah, I hadn't got to meet you yet, little buddy. I hadn't been here since you were born.
don't worry, no needles in your neck today.
And then he had kind of a rough start, didn't he?
Yeah, we had to do plasma and all that stuff.
Oh, he did go get plasma?
I think he must have got some from Tygan.
Okay,
said
good.
something about getting it from Glenwood.
Good.
Or
So he was low on
He got
the-
the IgG test from her.
And it was low.
He was like at 400.
Okay.
And so it was actually West up.
Because he didn't want to suck right away, I thought was part of his issue. He just wasn't figuring it out. Okay. Well, I think it looks like it, sorry?
We just have no idea what you guys have been saying.
We're whispering behind your back. I'm saying that he doesn't have a fever, and if it was a septic type of joint, I would expect him to be sicker and have multiple joints that were affected. And so I think it probably just because I keep seeing that circular lesion there, basically an OCD type of lesion, which are surgical. And so we'd have to talk to an orthopedic guy and see what they think about him. Can be fixed though. I mean, they're not horrible to take care of.
So we are down in quarantine, and we are going to start with Miss Sasha. It is rainy and wet and cold. Lovely. So this is Sasha, and she's supposed to be a 20-year-old. She didn't really seem to have many issues when we got her from the auction, but not too long after she was here, she was three-legged lame. Yeah. And we did take x-rays.
Did you notice any swelling or anything like that? Okay.
Swelling, but nothing like on the x-rays that we could see, so.
You noticed the swelling more here, you're saying?
Yeah.
Okay. She didn't have a tattoo, did she?
No.
Oh yeah, she does.
What was the one I looked at yesterday?
I think it's SE540.
Yeah, okay, I'm gonna write that down. Mid-teens. Okay, yeah, we'll trace it and see.
Yeah, I think she's younger. Which makes you wonder, maybe did she had that leg issue?
Right.
You're a good girl. She's like, I pick it up for you. It's so thick. Did you ask what it was? I'm surprised there's not more changes for how thick her fetlocks are. Let's maybe watch her move a little bit if I know we don't have a lot of room.
You wanna try and walk her around a little bit, Leah? Just walk her from one end to the other.
Maybe like a separate notepad and then we can. Yeah, I'll grab it.
Yeah, she's mostly, see how she's dropped so bad, like DSLD.
Okay.
And yes, there is a little bit of a change in that sesamoid, so that could be compounding it, but once they start doing this, you're not riding them.
Okay. Is that like something that's going to be painful, even just pasture sound?
Well, they can be pasture sound. The problem is eventually they start having trouble getting up and down when they slip on the ice and those kinds of things. But if you can give her some bute and manage her pain and decide if you want to have that sesamoid looked at a little bit further, or just kind of go with the idea that even if we fix that, she doesn't look like she'll be a rider to me because she drops too much in both of those hind ones. And then they just become not very coordinated and less safe to ride.
Okay. She doesn't really have anything wrong with her. She's just needs a vet check, really.
Little mini mule.
Just a little mini mule. Girl, said to be 20. But if we can look.
They said you're supposed to be very old, which if you're mule, maybe you're just middle-aged. Huh? Oh, hi, sweetie. There you go. She's just a baby.
You're a baby? Oh, I don't love you. I don't love you.
So she's not 20.
No.
She got wolf teeth, but that's okay.
No, Simone.
She's not 20. She's like not even 10. These are baby teeth. Well, they're adult teeth, but they're young. You know what I mean?
Young
Like
teeth,
these just came into wear, like she's less than 10. We call her 7.
Call her 7. Mules can hide their age at times, I
Sometimes
guess.
people look at the corner incisor and they don't see a groove. Well, the groove starts. It's like partway down at 12, halfway down at 15, going off the bottom, gone. And hers is gone. That's because it hasn't started. Hi, sweetheart. That's perfect. You have a youthful name too. This is sensible. So go to start for your then. And you just call her.
They freak out when they look at you. At the auction, she never threatened to kick. She just ran.
Were you doing this stuff?
Well, we were all just walking around her every which way, but.
Settle down. I'm so nervous.
You're okay.
Flight. You're okay, Simone.
You do some gymnastics, huh?
She's on rock the floor.
What?
Can you try her in the shoe?
Yeah, we could try.
Just touch you a little bit. Just touch you for a little bit. Push that. Push that. Great. Take wash. Well, I'm probably not going to get your temperature taken, I guess. Throwing burn marks in your tail.
Yeah.
Wait, I don't like maybe a ball compared to you. What's going on here? What's going on? Why are you doing so nervous? Both sides make you nervous, huh? What do you think? She's very tense. Okay. Well, she looks healthy otherwise. I don't want her to get pissed at me. But younger. That's great. Yeah. You're so young. Do you think your friend just walked by? Yeah, I think so. Get a new halter put on you so you don't run away when they try to put stuff on you. You're not going to like being measured, I think. You don't like it when I touch you. This is going to be fun. Yes. Yeah, goodness, honey, you need to get used to being touched. Wonder if she was just kind of out in pasture.
Yeah.
All right, so coming in next is Trinity. She's supposed to be 20 years old. Looks like she's got some roach back going on, maybe even some DSLD. And then at the option, she was only blind in the one eye. I think she recently lost vision in the other while being here.
Okay.
Pretty quickly.
Oh, honey. She's supposed to be all perch. Being inside might be a little scary.
Distraction.
Oh, we need to know where the grain bucket is, because, oh yeah, my goodness. Okay. Probably won't be able to get her to hold very still, will we? Hi, baby. Hi, baby.
She had sight in her one eye at the auction.
Mm-hmm.
And now it's very apparent that she does not have sight at all.
Yeah.
Yeah, we tested this.
It's a very mature cataract in that eye. Hi. Come on, Mare. Hey, hey, hey. I know you just can't hold still for this, can you? But a big girl like you should know to hold still. I'm not going to be able to get her
She
to
was
look at
doing
that.
a lot better before.
Was she?
Yeah, she was a lot.
Hey, hey, Mare. But yeah, if she's just losing it recently, it makes sense that she's more spooky. Hi, Mare. I know. I'm sorry. Well, I guess I'll let you keep your mouth busy for a second, honey. I'll look at that later. Hey, be nice. Be nice, Mare. There are people here. You got her good and distracted if I take her temp? Mm-hmm. But you said she seemed like she had vision in her right eye when you first got her here. So, I mean, we could, it just depends on how far you want to go with her, but you could definitely try a round of the doxy. And if, I mean, maybe you just get her out of here before she hurts. If you guys need, yeah, I think that's, I didn't get a chance to look at her mouth. My thought would be if it's an acute enough problem with her eye, you could do Banamine, doxycycline, like we did before for the one, just in case there's some sort of lepto or an infectious uveitis type of thing going on there, and Neopolydex on the surface.
Okay.
So if you have all those things, we'll try it. But if she's going to be like this, if she's blind, and she has a bad back, and you know what I mean?
Mark Spitz.
I don't know. Is this like Olympic?
Olympic athletes, yep.
Okay.
And he is supposed to be 20.
Everybody's 20.
Yeah, right. We didn't bid on him. Someone at the end came up to us and asked if we wanted him. Said he has some arthritis, so we took x-rays of him as well.
Okay.
And he's got some stuff going on.
So where did you notice? Was it this hock
front.
or this front? His knees?
And then I think we saw a little something in the backs.
Because I see he's got enough. He's got enough scars. Yeah. Hi, big fella. What do you think? Huh? You're kind of skinny. Hi. Oh, hi. You were sniffing me. You almost seem familiar. Yeah, 20s for him. Not like, ugh, you drooled on me. You might have some stuff going on back there because you're skinny. Having a hard time keeping your body temperature. And it kept saying low. He's only 95.2. Did it twice, so he's kind of thin. I'm sure he's having a little bit of trouble with keeping it on. So you guys said arthritis is what they told you about, and you took x-rays of his knees. We don't really have very far.
I believe we did.
You think we could back him up to the door and just do a short little walk here maybe, or take him to the door? I like the new mats.
I noticed that lump on his stifle just when he came in.
He's walking a little funky on his back legs too. Because his stifle isn't right either. What the heck? That's really weird looking. Oh, he's got a lump on the outside of it. That feels like scar tissue. That just sticks out when he moves, but it's like loose. See. Still could have a little bit of arthritis in this, even the tip, this is bone here, and that's regular skin scar tissue down there. So he probably has arthritis all over, but I wouldn't mind the way he walks. I wouldn't mind having his back kind of looked at because he really tucks a little bit like this when he walks. But we can take a look at his x-rays too. Yep. Oh, this is fun. I've seen worse in younger horses though, I'll say it that way.
Yeah.
Ooh, there you go.
DB showed it the other day.
Yeah, look at that sucker. That's really cool.
It is cool to see.
Well, it's like, I wonder if it was more incited by something though, because it's not, it's like right there. I mean, yeah, there's arthritis and stuff, but if he has an old injury or something, one of the ligaments there, or, made it worse in that particular spot. Wow, that is pretty remarkable. It's like a sunburst. And it's basically fused. This is his left, and that's starting to do the same thing. That's why we always do 2 views, right? Because these ones are like, yeah, there's some arthritis, but it's not like, it's not completely fused. There's still some joint space that you can see. And this is his hock. Yep, he's full of arthritis. Look at that. Yeah. So I'm sure that there's got to be some in his stifles too, the way he walks. Hi, sweetie. Did you make them fight to catch you, huh? Where were you, good kid? Dragon. You a dragon. Hi. Hi, sweetie. It's okay. Easy. Yeah. All right, no, now you're just being silly. I'm not going to let you get away with it. No. Delira. She keeps putting her tongue over her teeth. But she could even be a little bit older than 14. I just wanted to look at the cut surface of your teeth, and you're not letting me. We'll come back to that. We always end up with really good days for checks, don't we?
Okay, so this is Larissa, Larisa.
And you had an age? Is this the one that you had?
15.
Hey there. You got big toes. I know, it feels funny, but you're gonna tolerate it. Oh, you're old. We might be missing one too. Hey. There, hold still. Yeah, those are old teeth. Yeah, that's ancient teeth. Did somebody give you shots, honey? Oh.
That was there at the auction.
What? You don't like it when they move?
No, not like that.
It tells me it's not bone.
It makes
So.
me think of a knee.
Oh, a kneecap.
Yeah, that's just so gross.
Okay. Well, I guess I would just monitor it. It doesn't seem to be bothering her too much, and it does move, so somebody might have given her a shot and got too low or something. I'm going to take her temperature, but she is, unfortunately, the opposite direction, where she's older than you think.
Okay, so Gretchen's next.
Okay.
20s. I believe she's got a ruptured prepubic tendon.
She preggers?
Don't think so.
Okay. I guess you never know for sure if they've been exposed to a stallion. That's a nervous cow pie. You're a pretty girl, though. Hi.
I've seen you be good.
Hi, you're so nervous and you have such a snotty nose today. What's going on? That's yellow looking. Yeah, that's not good, honey. Easy, mama. Easy, mama. Easy. Yeah, I know. You seem like you're a little tense when I touch that part of you. Okay. I don't know if it is ruptured or if she's just got some other swelling going on. Hi. Be nice. Do you guys want me to test her with that snotty nose to make sure we're not dealing with what we don't want to deal with?
Would be a bad idea.
And you had her as middle-aged?
20, I believe.
Okay. Hey. Now you're just being silly. Hey, you're just being silly.
But
Yeah. So you had her as 20, but I mean, I would say 15 could be a little more accurate. Right at the base of the pelvis, and it's gonna be a little bit further back. I'm not certain. She wouldn't really let me touch it, but I don't know that that's really a pre-pubic tendon rupture, because that starts further back, and that part of her doesn't seem terribly low. So I mean, something could be ruptured more down here.
how would we find that out?
Ultrasound, yeah.
Okay, so this is Michael Phelps. Yep, he's supposed to be 7.
7. And had you guys noticed anything weird about him?
We did take x-rays.
Okay, he's got leg issues. Yeah, I mean, he could be more like 10, but, you know. No. Not 20, and not a 20-year-old that's actually 7 either, so. You want to hear it? It's really cool. Who wants to hear it? It's really cool. It's a loud one. See her just jump?
Wow.
It's a whoosh, whoosh, kind of high pitched.
It's like,
Whoa. So maybe that's why he got sold.
probably couldn't do their trips.
So it's at least a 3 as far as the grade. Left-sided, systolic. So I don't think you'll be an Olympic swimmer. Whatever he can handle.
Trails.
Yeah. Yeah, not high level. And anybody, I mean, they could take him to get it looked at because he's a young enough animal. I mean, but there's not much that they can really necessarily do about it. 98.7. Probably something he was, born with then. Yeah, so you guys had noticed maybe some.
He just kind of walking around a little bit. Yeah. Just look kind of like.
Tries to bow out.
Biggest straight line.
That's the problem in here, yeah. Yeah, he tucks underneath like he thinks he's like a gaited horse or something. Like a Pasofino walk.
Stepping kind of early.
He is. He doesn't step as far with his right.
Almost even doing this. No.
Try. Would he back up straight?
Come on, buddy.
He doesn't want to. Yeah, that's okay. He's not real interested in doing it. He's sloped kind of funny, and his hips stick out.
And then there's like this extra.
Oh, yep. He's got a little bit of that. Well, he's got more of that. That's like, you can feel the top part of the hip bone here. I think it's just more prominent on this side. He's rubbed them before. But maybe he did have a little bit of trouble with weight and stuff because of his heart. Yeah, that's just all part of that hip bone. He'd be one that, I'd be interested in her adjusting a little bit. But I wouldn't expect like a lot of athletics out of him.
So this is Brody Malone.
You guys look a lot alike.
He's supposed to be 20.
Yeah, right? He seems so very nervous. Hi, you don't gotta be so nervous. Hi. Oh. Oh. Oh, yeah, you. You're very nervous, aren't you, big guy? That wasn't me. That was somebody outside. Hi.
Just let her look.
Can I look in your mouth while you chew? I know you're busy. Oh, don't lose too much, right? He's like, oh, come on. I just got that. You take it away. It smells good. Yeah, you are. Take it easy. You said 20s on him?
Yeah.
Yeah, sounds good.
All right, so next one coming in, I think you pronounce it Rayssa, Rayssa.
Okay.
Wheel. We have her papers. She's 19. She was just used as a broodmare, and we took some X-rays because she's got a pretty big knee on her and bad feet and bad feet. That's right.
So she was a registered quarter horse? Okay. Oh yeah, you got a brand and everything. Hi. So the coffin bone on the same foot or the other one? Very bridged. Kind of like, you see how it kind of comes together, but it like left a hole as the little arms came together? Mm-hmm. Oh. She's pretty dropped too, it looks like.
Then is that something right there?
A little bit of ring bone.
To the left.
And she's pretty ouchy.
Yeah.
Okay. Well, girl, that's not good. Depends on if you guys want to have another founder horse trimmer, like trimming challenge.
He didn't think there'd be much he could do. It was about the tip of the coffin bone.
Yeah, it's already kind of, yeah. Oh yeah, she can't even like. Oh, honey. Oh, you're trying to be a good girl, aren't you? She's like, I'll pick it up for only a second. Can I please see it? You can't even put it on the other leg. Come on, let me see. I just want to see it for a second. Ugh. Come on. Yeah. She doesn't want to put any weight on that other toe. All right, well, that's not good. If we have knees and both feet are foundered in the front, rotated pretty bad.
So next is Usain Bolt. 20 years old, blind in his left eye. Otherwise, he just looks like he needs some weight and his feet done.
Yeah, you said 20s?
Yeah.
The old feet. Okay.
Hey, watch your mouth.
Are we getting a little bit toothy?
A little bit.
That one seems okay. So, obviously nothing we're gonna do about this unless we want to take it out if it bothers him.
Doesn't seem to bother him.
It's not. I mean, there's some blood vessels growing over the surface of it, but it doesn't seem like it's watering or anything. You know, rubbing his face. You watch for that kind of stuff, and then we can take it out and make him look like everybody.
Okay, so coming in now is Gabby Douglas. She's got bad knee, and looks like she might be prolapse in the back. She kind of blows air out all the time.
Oh, okay. And how old is she supposed to be?
She's supposed to be 20.
One big hole. Oh. Yeah, so she had a fall and it tore her up. She might be just shy of 20, but yeah.
Okay, we'll leave it.
The front of her, both rear fetlocks and her knee.
You said banged them up?
Yeah, you see that it's kind of scuffed up in the
Yeah.
front, and that one looks even a little thick too. Oh, your knee is awful. That's as far as it goes. Obviously, she doesn't mind putting weight on it when she picks up the other one. I mean, you could x-ray it, but we know there's a load of arthritis in there.
Okay, so coming in next is Ellen, E-L-I-N. Supposed to be 20 years old, standardbred. Looks like probably just had a foal recently, but she's got some kind of big lump on the side of her belly on her right side.
Oh, yuck. She broke her little tooth down here. It's just all, look at this face.
Oh, ouch, honey.
Look at this, the whole bottom. I don't even
Oh.
know if I could get a speculum in you to do this. They're all, I mean, all the roots are still in there, it looks like, but
You look like a beaver.
Are they broken off?
yeah. Without being able to see those, I think she's well into her 20s though, based on the top teeth.
Been like that since the auction too, just like that.
Okay, hasn't gotten any better or worse.
No.
Her poor legs back here.
Yeah, they were all bloody at the auction. Some scalding or something. Hernia.
Yeah, you see how I can push it in?
Yeah, I see.
Like that hole there?
Can we do anything about that now? Not now.
Really? She probably got injured, perfect, or maybe just from repeated pregnancies, but that's kind of far forward. It's not like a pre-pubic, like you were talking about last one, it's just like belly wall.
Right.
That would be, the size of it would be, like you're talking general surgery mesh FAU type of situation. That's huge.
That's huge.
But otherwise, it's big enough as long as, and she even walks kind of funny too, doesn't she? It's big enough that, in theory, some vets could go through it and twist. I can push it in if she doesn't like it when I do that.
Giant.
It could get bigger. All of a sudden, there's a whole bunch of stuff coming out, or a loop of bowel could get in there and twist, and she colics or something. So honestly, if she were to colic, I don't know that you know what I mean?
Right.
I wouldn't do much with it because it would probably be related, I would guess. But
Like a catastrophe potentially.
yeah.
Beezie, BZ Madden. 14-year-old draft. Really bad feet, and something's going on in her vaginal area. She's all kind of raw and torn up and split looking.
It's like she's so rashy down there.
Can't tell if she's like even split, like if she slipped and like maybe split it a little bit.
Right.
Can't even tell.
Yeah. I'm sure she'll be really excited to have that work done. Just want to see if she has a fever. We're going to do some Uniprim. I wonder what she'll do if you get her in a stock and get washing that out.
Wonder if we even just need like cold spray it, like
Yeah.
just spray it, not even really rub it right now. Just
Maybe 9.3, so she's not feverish at least. Because you have like a UTI that was draining down there.
Right.
Did she have an infection after having a hole?
yeah, I don't know.
That would be one that you'd want to sedate. It'd be nice to like lift a leg up and really, like you were saying, make sure there's not any other injuries up in there.
And I think she's got something going on in her hind legs too.
Okay.
Looks like but then like, or is it just that raw that it's so swollen that it's like
She's like, oh, that feels good.
oh my goodness.
Look at her. She's like, oh, do that.
Oh, rub it. Okay, get a picture. Okay, well, it's basically a really, really bad rash.
Well, she'll let us clean it.
Yeah, that's great. So you're gonna be hosing that out, and I would use Fiercin ointment, I think.
Okay.
Really, like, wash it out really good with like a gentle iodine type of wash, and put some Fiercin ointment in there.
Okay, perfect.
And she'll probably be like, let this air out.
Yeah. Okay, it's not cut.
Prim too, because I don't know. Yeah, it doesn't seem like it was cut. It's more like the worst diaper rash you've ever seen. You know what I mean? Like, or
Most
like
definitely.
urine scald. So I still don't know because of what was dripping out of her if she doesn't have like a UTI or something that started this. So we're gonna do Uniprim as well, just to be safe.
Okay. So this is Duffy, Duffy. He is supposed to be 20 years old. He's got something going, some kind of mass on his face, and then a big leg.
Oh, look at that. All right, let's take a look at you, Duffy. And that's right in a spot where I would think it would be a bad tooth. But you guys said you took X-rays.
We did, but we're no vets. We don't know what we're looking at.
Really hard.
I'm getting more familiar with legs, not mouths.
Mouths are another, yeah. 3. Like 4.5, 5, not even 5 years old. So I'd still want to see what's going on in his mouth though, because when they're that age and you have that kind of swelling, he could have a cap or something that's stuck in there.
We had a
You know
horse
what I mean?
like that
Something
here
that's-
one time that had a big.
Okay, his x-rays will be really interesting because you're going to see baby teeth and adult teeth trying to do their thing at the same time. And yeah, it's hard to tell where you're looking, isn't it?
Yeah, I think one of them we took a little lower.
Just how long they are. If he was old, they'd be like this. Interesting. It's not like there's some big weird.
No, there's
Lucency.
nothing.
Do you need him in here anymore?
No, you can get it.
You can take him out.
All right, next coming in is Clayton. He is a Belgian. He's supposed to be 20.
I'm not even gonna rate the ages until I look at it. Does that sound good?
Those are little teeth.
Yeah, see that's the adult one coming in underneath right there.
So you think like,
2.5, 3, 2.5, 4.5.
all right.
Look at that cool white spot on you.
Hard.
Harness mark.
You are so handsome. He's got a knee.
Got a knee.
Yep.
You guys have not.
We did take x-rays. Yep, we got them.
Okay.
It's pretty rough. You want to watch his face. He was turning and pinning.
Yeah, that's ugly for a youngin', especially.
We just didn't even do a comparison.
Yeah, we
Just
know
took a
there's-
lateral and a DP.
The flies are really terrible.
I don't know why. It's probably because the computer's
Oh,
warm.
look at that. There's even a piece broke off in the front.
Okay, we wondered what that was.
Yep, there's a piece that fractured off. And he's got so much. It's like the front and the back. Like it's even in the sesamoid, which is kind of weird. So I don't know what. If he ended up with a septic joint and it damaged it all over because he's pretty young for arthritis still.
Mm-hmm.
There's a piece right there. Well, that's going to be a chronic problem even if you took them in and they cleaned up these little pieces and whatnot and started doing joint injections. You know, just to make them more comfortable. It's going to be chronic.
Yep, standard bred bear. And she's supposed to be 20.
I'm not even ready.
And she was, when I was trying to get intake pictures, was running around pretty good. So I don't. But she's got a scar on her. Yeah. Oh, she cut herself, I see, too.
Man, you've done a number on your legs over time, haven't you, girl? I just hate their feet.
I know.
They don't need to look like that. No, that's just, it's all, ugh. Good girl. You had her as
20.
20? She's actually younger.
Younger?
Younger one for one.
You're younger.
Yeah, we'll put her at more like 14, 15.
Cool.
And you're actually very sweet.
Nice.
Yeah, and then just the left hind foot, the right front, and then that one was stubby, and
She's a little.
4 different legs. And
She looks like Polly needs to straighten everything out a little bit. Because, yeah, she's not dropping or anything like that, though, in that. She just got such a long toe. Poor thing. She must have really got a good wire cut on that top
Something.
or something. Because it's not even complete yet. You can see that little bit of granulation tissue next to
Yep.
it on the inside. Which, yeah. We can keep that sucker clean. I bet if we ripped all this stuff off. But why don't you let Polly kind of see what he can do with her feet and how she behaves once you get them straightened out.
Should we x-ray that?
Up here?
Yeah.
I don't know, you need to x-ray it. I think I would just work on her feet to start.
Okay.
If you haven't noticed her actually acting painful on the hawk.
No.
You a good girl for touching stuff, huh? I mean,
Lex is good.
goes right up. So.
The
Just
surface something then.
watch that granulation tissue on the inside, that we don't need to cut that sucker off. So it seems like it's healing over. So it should keep going, just keep it clean.
Okay.
So I'd just get her feet trimmed up to see if we can balance her a little bit first, and then if it seems like she is having a little trouble, then do some x-rays, but you'd just be taking x-rays of everything at this point, you know? So, which if you want, I guess. D-O.
Mondo.
There's a half wing.
We'll check his teeth
Yeah.
if we can. He's got that big bulge on his eye. Could be cancer. Could have got kicked in the face. I don't know. It's just a big bulge. It did burst open the other day,
The eyeball?
but it's still large. Yeah, his eye's still in there. I'm pretty sure.
Oh, that looks terrible.
He looks like he got in a fight. He's nervous, guys. So let's stay quiet. Do we want to put him in the chute? We could. Because we need to look at that eye close enough anyway. Yeah,
Whatever's
yeah.
going on in that lower eyelid is kind of weird, because I can't actually see the eyeball.
Right. It looks like it just above a little bit.
That was cute. I don't want to get up if he's going to start kicking like that.
Yeah.
But you got his head that way, right?
Yes, I do have his head.
Ready to hit the deck if I have to.
I do too.
He just broke the door. See that? Didn't even try that hard to do it. So it is really hard. Like you were talking about that last time. It ended up being cancer and had gotten into the bone. That's a little bit of my concern with him because of how hard that lower. You want me to try to check his age and stuff?
Probably not if you think it's cancer.
Kind of concerned that it is. I wouldn't know for sure without taking it out. We could try it, but he might be tough because you'd want to get really wide margins on something like that, and I don't know how much you could get. Without and knowing when he's sedated would be best. Yeah. Hi, buddy.
I mean, if he'll let you do the other stuff, I just don't want you getting hurt. He kind of does everything to get away.
Yeah. Because I'm surprised he isn't more pissy about this, but this is pretty hard here. Let's see what we can. Yeah, I mean, it feels foamy, so I'm kind of concerned that whatever. Well, unfortunately, he's kind of young.
What do you think? Like 10?
Yeah. It's really hard, but maybe he got something because he could have got something shoved in there too, and so it's really walled off and it's making a really hard scar.
Okay.
He's going to be a tough one to work on to get all that out. I'm not sure because I was kind of feeling around and everything in there is really hard.
We should maybe sedate him and like really
he'd
dig in there.
He'd have to be sedated and
see what's going on.
And honestly, I don't know if he'd even be good for just working on the eye with a general sedation. He might need to be somewhere like for general surgery all the way out because whatever we got to scoop out of there. So
He can go out.
what?
He can go out.
Just I don't know if I even want to reach my arms in next to him.
That's fine. You want to open him? Let him out.
I would plan on, because he's young enough, he's a little bit naughty. That kind of smells. Finger in there. It smells a little more infected, so maybe he just got something hard stuck in there, and he'd be more of a candidate for like Stillwater general surgery. Lay him out because I don't think he wouldn't tolerate a standing enucleation.
Okay.